Hi guys, welcome back to my channel. In today's video, I'm going to be talking about the differences so far in my experiences between clinic nursing and hospital nursing. So if you guys are interested in that, then please be sure to stay tuned. All right, first off, please ignore that I'm in the car. I ran away from my children. They're in the house right now. It was going to be chaotic, but I just wanted to film this video. It's my only chance to film. So yes, so I wanted to kind of just talk about my experience so far and kind of like the differences between a clinic nurse, which is like a nurse who works in the doctor's office, versus a nurse who works in, say, like the hospital setting. So I've been both. I'm currently both, actually. I'm working more in the hospital now than in the doctor's office, but I've always been in the doctor's office for my medical journey or nursing journey, whatnot. So let's just start with the office. So I started off at the office. So the office, so for both jobs, you can actually just set your schedule as PRN, part-time, or full-time. It just depends on the shift that you're working. So at the clinic, most clinic nurses will work full-time there, and it's basically like your 9-to-5 job. So or it's technically 8 to 5, and you work Monday through Friday. Most of the offices are closed on weekends, so lots of nurses enjoy having the weekends off with their kids, having a schedule 8 to 5. You know your schedule. You get home early and you have a good night. You have a good sleep schedule. Now, for a hospital setting, you pick your shifts. So it's usually 3 shifts per week, 3 12-hour shifts. And you can do it 3 in a row. Some nurses do 3 in a row. Some do 1 day on, 1 day off. Some nurses do 2 days on, 1 day off. It just depends on your schedule. Some nurses will work like 6 or 7 days in a row and then get like 6 or 7 days in a row off. So that's kind of like the difference between the schedule. Now, for hospital setting, you usually make your schedule like 6 weeks in advance, so you're able to kind of see when you can take vacations or when you can set up appointments, stuff like that. As far as clinic nursing, you know that your schedule is Monday through Friday, so it's a little bit harder to like ask off to go to appointments or not, because your day is pretty much kind of gone if you're working 8 to 5. Same thing with and that's 5 days in a row, compared to clinic or hospital where you're working 12 hours, but you have 2 days off technically. If you work the morning shift, you're working from 7 to 7, and then you get 2 days off. Or technically, 4 days off. But if you work night shift, it's a little bit more, you don't get as much sleep once you gain that back because you're working night shift, and then that next day is pretty much your 4th day is pretty much your catching up schedule. So it's it varies with sleep schedule. Night shift schedule, you're always going to be deprived of sleep. But if you work day shift, you'll get your time where it's the 3 days in a row. Okay, sorry guys, I got cut off because my husband was calling me, but I think I was talking about the schedule. So pretty much if you work the hospital, you work 3 days. You can pick up overtime and work 4 days, 5 days overtime hours. If you work at the clinic, basically it's 5 days in a row. Or if you choose to be part-time, which I've done, I just work a couple days, or I would just be PRN, or per diem. You would say, I just tell them when I can come work, or they'll text and I'll say I can come work. That's kind of how I've been doing it now. I work at the hospital full time, and at the clinic I work PRN, per diem, whatnot, whenever they need me, and if I'm available. So I've worked at both places. I've enjoyed both places. Now, as far as pay, of course, the clinics, you're not going to get paid as much as in the hospital setting. It's just, workload is different. Of course, you can get paid differently. Clinics aren't as big as hospitals, so you're going to get paid not as much as the hospital, from my experience. As far as specialty clinics, you could probably get paid a little bit more just from experience. Now I know like cosmetic or nurse injectors, they can make a lot of money, probably as much as hospital settings. I don't know. But I've heard lots of people making money in that kind of setting, specialty. But as far as I know, hospital setting, like versus primary care, you're going to get paid more at the hospital. And night shift, you'll get paid differentials for night shift. So if you work night shift at the hospital, you'll get paid a little bit more just because it's night, and then weekends, of course, you would get paid that differential also. So it kind of varies. You know, you get paid a little bit more, but you lose sleep and beauty. You know, you just kind of choose, you know, one or the other. But yes, so I choose night shift right now just because it works a little bit better for me with the kids in the school and my schedule, and with kids, people watching the kids and whatnot. So I'm choosing night shift just because it works better. And then at the office, I'll work during the day. So sometimes I work night shift at the hospital, and then I'll go work in the morning till like 12 at the hospital or at the clinic. Or sometimes I'll work at the clinic in the morning and then go work at the hospital at night. So it just kind of depends. Let me see what else. What other differences? It's just if you work at the clinic, you know, your schedule is pretty set. At the hospital, actually, you can get a set schedule where you work the same days every week, like Monday, Tuesday, Wednesday, Monday, Tuesday, Wednesday, Monday, Tuesday. So you know you have a set 3 days on and 4 days off. So it kind of varies. It just depends on what kind of setting you like, primary care versus acute care or hospital setting, you know, like being in a unit. Of course, you're going to get more experience and hands-on. I think at the hospital, you're using more critical thinking, whilst at the clinic, just depending on the clinic, you're like set at that skill, like primary care, pediatric, you're kind of just doing that, and you'll see the same thing over and over. I guess you will see the same thing at the hospital if you're in the same unit. You know, you're taking care of the same type of patients too. So it's kind of like the same. But for me right now, I think I like the hospital setting just because I want to work on my critical thinking and just getting more knowledge. I still love being in primary care. That's my end goal, is being a primary care nurse or nurse practitioner. But I'm in the hospital now just to gain more experience. I'm medical surgical, just to get my brain going and get familiar with looking at labs and looking at patients and, you know, just all that. So for now, I like it. And, you know, every nursing student, if you're in nursing school, they always tell you, just go for med surg so you can learn. You don't have to, but it is a place where you can learn a lot. Of course, if you go to ICU or ER, you're going to learn a lot as well. So yeah. What else? I'm trying to think of what else I can tell you as a difference between a clinic versus a hospital, but I think that's all I can think of right now. So if there's anything else, or if other nurses, clinic nurses or hospital nurses, if you have anything to chime in, just list it down below. I'm pretty sure prospective nursing students would like to know as well. And yeah, so I hope you guys enjoyed the video. Please ignore the background. I like to tell you guys, I am a mother of 4 nursing students, full-time employee plus PRN. So I just find time to film when I can, and right now I'm just running away from the kids. They're like looking at me from the window because I told them I needed to get something in the car. So if I was sitting there, it would be a chaotic mess. But yeah, so I hope you guys enjoyed the video. I have more videos coming soon. I do have like little unboxings of stuff because this mama works hard and this mama likes to treat herself as well. You only live one life. Working hard, let me enjoy it as well. So you'll see those types of videos. You don't have to watch those if you're not interested. But yeah, I will try to make more nursing videos. I think my next video I'm going to be talking about is my experience between pediatric nursing and adult care nursing. So if you guys are interested, please be sure to subscribe, like, and I will see you guys in the next video.